How to take a fever history in an infant younger than 6 months. When assessing fever in an infant under 6 months of age, a structured and careful history is essential. This age group is highly vulnerable, and subtle findings may indicate serious illness. First, duration of fever. Ask about how long the fever has been present. This helps differentiate between an acute fever and a prolonged or persistent one. Second, associated symptoms. Inquire about accompanying symptoms such as cough, vomiting, diarrhea, poor feeding, skin rash, or increased irritability. These symptoms help identify which body system may be involved. Third, feeding and activity level. Assess feeding patterns and activity. Poor feeding or lethargy is particularly concerning in young infants and should never be overlooked. Fourth, urine output and color. Ask about the frequency and color of urine to help exclude urinary tract infection or dehydration. Fifth, contact history. Determine whether there has been contact with sick family members or close contacts, as this may suggest a contagious source. Sixth, perinatal history. Review the birth history, including mode of delivery, any postnatal complications, and whether the infant required neonatal intensive care. These factors can significantly affect immune status. Seventh, vaccination history. Confirm whether the infant has received vaccinations according to schedule, or if there are any delays. Eighth, drug history. Ask if any antipyretics or medications were given before presentation, and document the dose and timing. Ninth, red flag symptoms. Actively screen for danger signs such as persistent vomiting, marked irritability, weak or abnormal cry, cyanosis, bulging fontanelle, or convulsions. Key clinical message. Any infant younger than 3 months presenting with fever must be evaluated in a hospital setting. Serious bacterial infections must be excluded, including sepsis, meningitis, urinary tract infection, and pneumonia.